Hello ladies, this is Dr. Shweta. So I have come again with one more informative video for you all. So today's topic is on why do new moms get low back pain. So in my practice, I've seen many of my patients like postpartum who complain of low back pain immediately after the birth of their babies. After 2 to 3 weeks or after 1 month, they develop low back pain. So why do they get low back pain? So when a female is in a pregnant state, is in the process of pregnancy, our body releases a hormone called relaxin, and relaxin is a hormone which is responsible for loosening of the ligaments in the joints. That is basically responsible for loosening the joints, so that our body gets prepared for the delivery. So that is a natural phenomena of our body, which helps our body to ease out the process of delivery, and the effort for both mother and the baby becomes less. So in the process, what happens, the sacroiliac joints, the symphysis pubis, the pelvic area, that gets affected the most, and that becomes a little loosened, and the muscles around that becomes a little more weak. So that is one of the major causes of low back pain after the pregnancy. And when the baby is born, the mother has to do she's loaded up with lots of responsibilities, like taking care of the baby, taking care of the home. And sometimes when you're abroad, then you have to land up into the kitchen very soon. Like, you don't get that kind of rest that what is required after the pregnancy. So that is also one of the major reasons why females they get pain, because in the low back, because they constant bending, doing the kitchen work, and they don't know how to, the body is weak, it's not prepared for that, but they have to do all that work because there's no other option. And the sleepless nights, the stress, all those things add up to all the to add up to the production of this kind of a low back pain. So this is one of the reasons. The second reason is, as you all know, during pregnancy the uterus grows in size, and and the abdomen overstretches. That causes the rectus abdominis to overstretch, and it disturbs the core muscles basically. Okay, the core muscles are formed by the transverse abdominis, which is present at the front, and the multifidus, which is at the back. Multifidus is a kind of a cement which is there in our spine. That muscle is like a cement which binds our spine together, and we have a natural belt in our body which is formed by these muscles, right? And when the rectus abdominis, the abdomen overstretches, that causes a disturbance in that belt, that core. And that is a major reason why after the pregnancy the core muscles are weak, and the female is not able to take that kind of load. The back is not ready to take that kind of load, and that's why they land up in the low back pain. So these are the two main reasons. In the next video, I'll talk about core stability, how to strengthen, how to do postpartum care, how you can cope up with that kind of pain. So stay in touch and take care.